What were you doing at 7 o'clock this morning? 99 United States senators were up at work and voting. And it was as if that party aisle was a solid brick wall. Every Democrat and 2 independents said yes. Every Republican said no, except for one who didn't show up for the vote, and that was that. Healthcare bill, Senate version, now passed, adjourned, go home, happy holidays. Well, there's no healthcare reform just yet, but with the House version done, that's 2 down, a House and a Senate version, and plenty of work to do before some form of merged plan then goes to the president. Now, the man who's about to appear on screen right there, he is one of this morning's nay voters. Senator Mike Crapo is a Republican from Idaho. Senator, stay right there. I'm going to talk to you in a second about the bill. But first, watch this with me. It's President Obama speaking shortly after you and your colleagues' historic vote today. Play it.
Ever since Teddy Roosevelt first called for reform in 1912, 7 presidents, Democrats and Republicans alike, have taken up the cause of reform. Time and time again, such efforts have been blocked by special interest lobbyists who've perpetuated a status quo that works better for the insurance industry than it does for the American people. But with passage of reform bills in both the House and the Senate, we are now finally poised to deliver on the promise of real, meaningful health insurance reform that will bring additional security and stability to the American people.
All right, live with me now from Capitol Hill, Idaho Republican Senator Mike Crapo, one of the few people left around the Senate right now because most of your colleagues wanted to get out of there after weeks and weeks of this thing. Senator, thanks for being with us.
Well, thank you.
All right, Senator, there are a lot of people unhappy this morning, some because they don't like the bill, some of your colleagues and supporters, some because they are frankly disgusted by the antics that went on in the Senate in the last few weeks. What have you got to say about that, first of all?
Well, I think it was a terrible message the way this bill moved forward. You know, the president promised that it would be negotiated with everybody at the table and with a C-SPAN camera there to see who was cutting the deals and who was really working for America. Yet the bill was crafted behind closed doors with no input from really anybody but those who were there. And we just got the last 400 pages of it last Friday or Saturday morning, and still have not had an opportunity to find out really what's in it. We are finding out, however, about the deals. And I think the public is as unhappy with the substance of this bill as they are with the process of the bill.
Let's talk about, I spoke to your colleague, Senator Kay Bailey Hutchison, yesterday. Some of your colleagues are questioning the very constitutionality of key parts of that bill. Are you part of that group? Do you think it's possible that this bill is unconstitutional?
Yes, I think there are parts of it that very likely are unconstitutional, such as the individual mandate forcing all Americans to purchase insurance or pay fines and penalties. There are also parts of the bill that seek to stop future Congresses from changing it without getting a 2/3 vote. In other words, trying to bind future Congresses and stopping them from doing anything that would undercut or change the direction of this legislation.
And in fact, some people are talking about running in the next election or running for re-election in the next election on under a repeal health care platform.
Oh, yes, there's a tremendous amount of dissatisfaction with this bill across the country. In fact, one of the reasons I'm sure that it was forced through before Christmas was to get it done and off the table, so to speak, before the American public has an opportunity to truly understand it and before the members of the Senate have to go back to their constituencies in their home states and face their public. The people in this country are 2-1 against this bill, and for good reason, because it doesn't really achieve health care reform. It doesn't bring down the cost of health care, it drives it up. But it does so at a cost of $2.5 trillion of new federal spending and hundreds of billions of dollars of new taxes.
Well, I have to tell you, I don't want to dispute your facts. We don't have polling that shows 2-1 against the poll. We show almost an even split, and that's not clear that people don't want health care reform. They just may not like this particular bill. Senator Crapo, are you planning on going home, or are you just loving Washington so much that you're going to stay there?
I'm on my way home.
All right, you have a safe holiday, and thanks for joining us today.
Thank you.
Senator Mike Crapo of Idaho.